Pay close attention. What you're about to see is Bible prophecy being fulfilled.
Welcome to another edition of YPN News, bringing you the news that relates to Bible prophecy and foretold by Yeshua Hawkins. Well, in the news today, coronavirus pretty much dominating the stories that we'll be covering. Scientists are now finding a new way to test for COVID-19 in a pretty unique fashion, actually testing the wastewater. So we'll have several stories on those. Also, doctors, nurses, anyone in the healthcare facilities feeling a lot of pressure these days with all the patients coming in. They're starting now to, it's starting to take a toll on them as far as the stress, depression, and also insomnia, not even being able to properly rest because of the stress they're under. So those stories and many more. But first, the United States Army is experiencing a steady increase in suicides, up by 30% this year. Now, these shocking statistics have awakened people to recognize the seriousness of the problem. Now the military is making a concerted effort to understand the reason why so many men and women are taking their own lives and how to turn it around.
That's right. One such soldier was Staff Sergeant Jason Lowe, a paratrooper with the elite 82nd Airborne. He took his own life this past August, leaving behind a broken-hearted family, especially his father, Tom Lowe, who told CBS News in an interview there was not an indication, not one indication of anything that was wrong. We still are so shocked. We had no idea. And he said that was the worst part, not knowing.
Well, including Jason Lowe, there have been 15 suicides at Fort Bragg alone this year. Now, what's even more troubling is this is the leading cause of death there. Now, Jason's father says the numbers are an indication that the military is not doing enough to help soldiers who are struggling.
Well, the Army's Vice Chief of Staff, General Joseph Martin, told CBS News, "We noticed in the month of April an increase in the amount of suicides, and we decided to take action. The main question on everybody's mind is, why?" Well, however, they do not have an answer for that. Regardless, General Martin says the Army has to recognize when a soldier is in need of help.
Well, the general concluded by saying everybody's got a breaking point. Question is, who's going to be able to see when we're getting close to that breaking point and say, hey, I think you need some help. But Tom Lowe is skeptical. Now, he was very close to his son and had no clue that he was about to take his life. So he's not sure what the Army can do, but he knows that they need to do something. And that is kind of strange that you would not see any clues, when somebody is suffering like that. But, even knowing his son so well, didn't see it coming.
Yeah, that's pretty sad. And one more sad fact concerning Fort Bragg is 3 times as many soldiers have died by suicide than were killed by the enemy. And that is really, a sad fact, considering people who go into the military, they expect that they probably will see some battle. They know that it's a risk that they might lose their life, but they're actually losing their life in most cases by their own hands.
Right. Well, a community of 30,000 in southeast Texas is being told to boil their tap water due to the recent death of a 6-year-old boy. Now, the cause of the boy's death, officials are reporting, is a brain-eating parasite that has infiltrated the town's water supply.
Hundreds of residents in Lake Jackson, Texas stood in line waiting to receive bottled water since the brain-eating amoeba was discovered in the local water supply. Just 3 weeks earlier, Maria Castillo lost her 6-year-old son Josiah to that parasite. Castillo told reporters the organism spread so quickly that her son's small body couldn't fight it. From the first day he showed symptoms, starting with the headache, Josiah died just 6 days later in the hospital.
Well, the boy was diagnosed with Naegleria foliaria, a rare brain-eating amoeba that Castillo believes her son became infected with while playing at a local splash pad, which has since been closed. Now, however, authorities are uncertain that that was actually the source. They're thinking it could have come from a water hose at their home.
Interesting. Well, according to the Centers for Disease Control, the brain-eating parasite is found in warm freshwater lakes and rivers. People can be infected when the amoeba enters the nose. However, they cannot get infected, they say, if they swallow it. Well, state officials say they are now working with the city to flush and disinfect the entire city's water system. For Maria Castillo and her family, though, it's too late. They have lost their child, but they are hopeful bringing awareness to the community will help save the lives of other children.
Well, the coronavirus is continuing to take its toll on the United States, across the United States, but also other parts of the world as well. So scientists are trying to stay one step ahead of the virus. So far, they haven't been successful in doing so, but now they're learning to test in a certain spot there to see higher concentrations. Where are they testing? In wastewater. Take a look at this video.
As of today, March 20th, 2020, it is known that the coronavirus is most likely spread from person to person during close contact, less than 2 meters, 6 foot. When an infected person coughs or sneezes, respiratory droplets can be transmitted from one person to another, similar to how influenza and other respiratory pathogens spread. It is very likely that the coronavirus can also be transmitted by touching contaminated surfaces or objects. However, it is unclear how long the virus can survive on different surfaces and at what rate a person can get COVID-19 from contaminated surfaces. It was recently published, for example, in the New England Journal of Medicine that COVID-19 may be transmitted through the fecal-oral route. This means that the coronavirus was detected in patients' stool at a rate which could lead to transmission of the virus by direct contact. Of course, the direct contact is very unlikely, but through toilet flushing, the coronavirus will dilute with wastewater and go over into sewer systems. It is still unclear how long the coronavirus can survive in wastewater, but previous studies investigating persistence of coronavirus surrogates and SARS in wastewater highlight that in the absence of disinfection, the virus can survive in wastewater from hours to days. On February 5, 2020, the U.S. Occupational Safety and Health Administration, OSHA, published a guideline for disinfection conditions in WRRFs regarding the coronavirus to protect personnel at wastewater treatment facilities and the public health. All in all, the transmission of COVID-19 through sufficiently treated wastewater is nearly impossible. However, in countries where lower wastewater treatment standards apply, an infection with COVID-19, especially by direct contact with wastewater, might be possible.
Well, it's interesting that they're able to look at the wastewater as an early indicator of the spread of the coronavirus to see how quickly or how concentrated it is in certain areas. Well, as clinical trials continue in the search for a vaccine, a new and unusual study has begun by researchers at the Canadian universities of Calgary and Ryerson. The goal is to understand the path COVID-19 is on before the second wave starts by testing the human wastewater. Well, the hope is that it could become an early warning system to know where outbreaks are going to take place.
Well, since the spread of COVID-19 worldwide, the focus has been on containing the disease. Healthcare professionals and scientists alike know it is inevitable that there will be a second wave, and it might even go further with a third or fourth wave the way this thing is looking. Well, one intensive care specialist, Jamie Spiegelman, told Global National, "There's never been a pandemic in the history of humankind where there hasn't been a second wave. So I do think this is not over yet," he said.
Well, thus the need to figure out where and when new outbreaks will take place. A Canadian-created pandemic predicting software known as Blue Dot was used successfully to predict the original spread of COVID-19. Now, it is monitoring the internet for signs of the second wave. That, coupled with the wastewater research team at Ryerson University in Toronto, could make for a potentially effective warning system. And if researchers see levels of COVID spike in the wastewater, then they'll know a second wave is coming, possibly 2 to 3 weeks in advance of a severe outbreak.
Well, a large city here in Texas, actually Austin, Texas, has been doing just that, testing the wastewater to possibly determine where the largest concentrations of the coronavirus are with the people in those areas. Right. So our field correspondent Larry McGee has the details. Larry, what is Austin doing, and how is this research helping them find where these outbreaks of coronavirus are taking place?
Just as the top experts were predicting, the plague of the coronavirus has now made its way into the world's waters, with the result that some scientists are now attempting to gain an early read on the presence and trajectory of the virus by testing wastewater. Since the virus is fecally shed, by monitoring the sewage of various locations, environmental scientists hope to notice when the signal of the virus is increasing in a particular area, so that they can then alert the residents and recommend testing. For now, the tests are being conducted at a university in Austin, Texas, and certain other parts of the city. But the group of investigators involved in the effort would like to expand and ultimately become a resource for early detection for the municipality as a whole. The world's leading expert on the coronavirus has been identifying Italy as the place of origin for the outbreak the whole time. And now a study has surfaced which supports that assertion, revealing that the outbreak began in the nation a significant while before it was previously thought. By examining wastewater, officials were able to determine that the plague was actually present in northern Italy as early as the 12th Roman month of last year, which is 2 months earlier than what was believed to be its first case in the second month of this year. The study shows that the virus was present in Italy before the first cases reported in China. Italy became recognized as the epicenter of the transgenerational pathogen by the 3rd Roman month of this year, but after 34,000 deaths in the country, it has now seen the numbers stabilize somewhat and is looking to open for the sake of its economy. For YPN News, I'm Larry McGee. Katan Jeff, back to you.
Interesting. Well, it's really hard for them to try to get a hold of things, even though they are engaging in this testing, not only in the United States, but also we see over in Europe, they're having a very hard time trying to contain this COVID-19 as it continues to spread. Right. Well, up next is an all too common video of a son's account of his parents' demise and eventual death after they contracted COVID-19. Take a look at his story in his own words.
This is actually a spot that my mother had scouted out previously, and ultimately this is where she wanted to be buried. And she liked the fact that on a beautiful day it just faced straight up into the sky. She ended up in Queens, ended up loving being here because it was outside of the hustle and bustle. I had ordered the headstone, but unfortunately so many people had passed away, there was actually a backlog. So for now, they have a marker that is just temporary. I don't think it's easy for anyone to lose both their parents. It's devastating, it's shocking, it's world and life changing. And I think in a lot of ways, I feel as if I was shell-shocked. My mother's name is El Jari. Her father and family supported her to pursue her dreams to study opera. She wanted to continue her studies in New York, and that's when she met my dad. And his friends invited him up to New York for vacation, and they brought him to one of my mom's recitals where he actually fell in love with her, right there on the spot. And here I am. So it really is a true New York love story. And I think it's important that people know they found love in New York, built a family in New York, and just adored everything about New York. And unfortunately, they also both passed away in New York. COVID was raging in New York in April, and they were so scared of catching COVID, they literally self-quarantined, and I would run errands for them and try to have them not go outside. Unfortunately, my mom needed to go out just one day, And on that one day, she went out and someone coughed in her face. And that's how she contracted it, definitely. I remember her coming home and calling me and telling me how furious she was that someone coughed directly into her face. And that was the moment. If you look at the number of days thereafter when she got sick, that was the moment that she contracted it. And obviously she spread it to my father unwittingly. They took her to the hospital, and 5 days later, unfortunately, she passed away early in the morning. When I told my father, I could just see the life drained from his face. And at that moment, everything changed for him. And it devastated him. And I think at that moment, that's when he decided he didn't want to go on. I'm glad that he didn't suffer as much. I'm just sorry, he really passed away from a broken heart. Well, I think as an essential healthcare worker, I was frustrated to see how it was handled on the local and other levels when it comes to government. So when my mother passed away, she spent, I believe it was almost 21 days in a freezer before they can bring her to the cemetery. And my father, we had the same situation. We could have prevented so much, but it's not going to get them back at this point. So let's be productive. And that's the most important part, sharing their story, letting the world know that these are people with full lives, and they contributed to their communities, contributed to the cities they lived in. And that's what I wanted to convey. I wanted people to know that's who they were.
And the sad story right there that actually the healthcare worker, he's in the healthcare profession himself,
Right.
in the steps that his parents took to try to prevent themselves from getting the COVID-19,
Right.
and just one person coughing, has coughed in his mother's face, and then of course it started from there. So, very easily transmitted person to
That's right.
person.
That's right.
Well, doctors and nurses are being hit hard in the mental health department as COVID-19 takes a toll on healthcare workers, they being at the front line of this pandemic. Now, a study of frontline medical workers at the height of this pandemic in New York City found that 57% of them suffered from acute stress, while 48% saw depressive symptoms, and almost 75% experienced insomnia. Now, doctors in New York City, New Mexico, and Florida spoke to CBS News this morning about the kind of stress that they face on a daily basis.
That's right. Doctors stated that they're all tired emotionally, intellectually, and spiritually, and that some of them meet criteria for emotional depression. Well, even in the hospital, there are some areas that they don't even like walking past because of the troubling cases that they remember, such as a 24-year-old man who died from a stroke, or a 25-year-old man who died with his wife and his parents at his bedside.
Well, other healthcare workers say that they can't sleep because of the nightmares that they suffer from, seeing images of the patient that they took care of last and the suffering that they went through. Now, along with the stress of having the burden of deciding who lives and who dies. Now, they express how they feel a difference in their personality and how they might be suffering from slight PTSD. Now, they worry if they're going to live the next day or if they'll bring COVID home to their families, stressors added to an already heavy emotional load.
Yeah, I bet. When asked why do they think it's so difficult for health workers to discuss these issues, the answer was, well, we're kind of expected to just suck it up or to compartmentalize everything we see. We feel as though we won't be valued in our profession if we speak on what we live with our daily lives. And what kind, as she said, that's kind of a part of us. We can't separate the two, but, we don't want to talk about it. Another doctor said, white coat makes a great straitjacket, that we don't talk about the things we need to, and that needs to stop.
Well, all the billboard boasting healthcare workers as heroes adds to the burden of keeping things in. Now, one doctor said, when you look at yourself and realize, I'm no hero, I'm broken, I'm hurting, it's just another point of self-critique that I'm supposed to be this hero now, and I'm not. And it's just another point of pain. We're seen as resilient and unbreakable, and if we don't address what we have going on internally, it's really difficult to adequately care for our patients.
That's right. And lastly, health workers said COVID-19 has provided us the ability to talk about our own vulnerabilities and say that's okay, because from vulnerability, they said, that's the birthplace for courage, that's the birthplace of joy, and I think it's really important to be okay with that. And we can see that, of course, COVID-19 is a virus, yes, in itself, but it's not just affecting people on the physical level, it's affecting people on the emotional and the mental level and taking a huge toll, especially on the healthcare workers and people who are losing family members that are very close to them as a result of this virus. Well, we know that true joy comes from peace of mind one gets when they're taught and they practice, share this practicing of the keeping of the laws that bring peace, joy, and abundant living. And the only place that's offering that right now is Yisrael Hawkins and the House of Yahweh. Now there, you'll learn how to truly enjoy life instead of just trying to avoid death. To find out more about the true way of life and how to protect yourself from what is to come, definitely, scientists are even saying a second wave of this COVID-19 is going to come and affect the world. Contact the House of Yahweh, and when you do, don't forget to request your free copy of the Prophetic Word magazine and the monthly newsletter. Here's how.
To contact the House of Yahweh, you can write them at the House of Yahweh, P.O. Box 2498, Abilene, Texas 79604. You can call them at 1-800-613-9494. Visit them on any of their websites by going to Yahweh.com, YisraelHawkins.com, or Yahweh'sBranch.com. You can also visit our website by going to YPNnews.com. If you would like to email the House of Yahweh, you can do so by emailing info@Yahweh.com. For any international calls, please call the number that's on your screen now. And once again, please check out the Yisrael Says program by going to YisraelSays.com or the Ask Yisrael program by going to AskYisrael.com. You can put any search in the search box there. You'll pull up pages and pages of scriptural information guaranteed to occupy your time and increase your knowledge on any scriptural topic.
Well, don't go anywhere. Up next, another very informative and exciting sermon by Yisrael Hawkins. For all of us here at YPN News, I'm Katan Alexander.
And I'm Jeffrey Heimerman.
Thank you for watching.